OsteoBites is a weekly osteosarcoma webinar and podcast presented by MIB Agents. This week, we're talking with Shohet, registered nurse, and Dr. David Poplack, Director of Global Hematology Oncology, Pediatric Excellence, and Associate Director at Texas Children's Cancer and Hematology Centers. Our panelists are Alexis Johnson, OsteoWarrior and MIB Agents Junior Board Member and Mission Commander, and Amanda Levine, an OsteoWarrior and osteosarcoma patient advocate. I'm your host, Anne Graham. Welcome, everyone. The snacks today at MIB Agents HQ is chocolate-covered almonds, and I also added in some walnuts because I got to stay on my brain game today because we have two really smart, really cool guests. With us today, we have Shohet. She is a registered nurse, and Dr. David Poplack, who is a legend in pediatric oncology. They're with us today to talk about Passport for Care, a program for survivorship planning through an interactive website. We have a great panel, as usual, with OsteoWarrior's Alexis Johnson. She is an MIB Agent Junior Board Member, our Mission Commander, and a medical student. Amanda Levine is on the panel as well. She is also an OsteoWarrior, an osteosarcoma patient advocate, who's brilliant and outstanding in all things. And I'm your host, Anne Graham, an OsteoWarrior and MIB Agents president. Excited to get started, but first wanted to tell you about some really big news at MIB Agents today. You all know about our book, Osteosarcoma From Our Families to Yours. It's available for free download on our website. It's now available in China and in Chinese. This is with thanks to Mr. Hans Lee, whose son Max has osteosarcoma and is fighting it. As he's fighting it, he connected us with Shiyu Children's Foundation in China to make the Chinese language version available all across that country and in America. Dr. Alex Wang and Dr. Mei Zhang of UH Rainbow Babies and Case Western Reserve University helped us with the translation. And so available through Shiyu in China and on our website for a free download, along with our English version. In addition to the book, our mission, our life, our purpose at MIB Agents is to provide direct patient and family support for osteosarcoma families, and also to bring together the physician, researcher, and patient community in the spirit of collaboration and education annually at our MIB Agents Factor Conference and weekly here on OsteoBites. And we also, finally, fund osteosarcoma specific research. We have over 200 volunteers and a dedicated medical and researcher community that helps make all of that happen.
Sure. Great. Thank you so much for having us here today, Anne, and everybody. We're really excited to be able to share some information about the Passport for Care. I am a nurse practitioner. I've been a nurse, I like to tell people, for longer than most people have been alive, since back in the old days when nurses wore caps. So I'm just not going to let you know what the date was. But I have done pediatric oncology, nursing, and practice as a nurse practitioner in solid tumors and bone marrow transplant, and now in survivorship. I work at the Texas Children's Cancer Center with the survivorship team, specifically taking care of the Passport for Care. I don't see patients in the clinic anymore. I work as a navigator for the Passport. So I deal with our clinics, our over 140 clinics around the world, and over 40,000 survivors that use the Passport. So we're really excited to be here today. Thank you.
Dr. Poplack, please introduce yourself, but if that's your real background, I'm surprised you joined us at all.
Thanks, Anne. I'm actually barefoot, and but it's a pleasure to be here, even on the beach. I am a pediatric oncologist. I'm a professor of pediatric oncology at Baylor College of Medicine. I led the Texas Children's Cancer Center for over 2 decades, and prior to that was at the National Cancer Institute in the pediatric branch, and I'm passionate about cancer survivorship.
Hi guys, I'm Alexis Johnson. I'm a second-year medical student at the University of Arizona. I've been involved with MIB for many years now. It's very dear to my heart. I serve as mission commander and on the board, and I'm happy to be here with all of you.
I'm Amanda, and I'm also honored to be here with you. I've been involved with the public and private OS groups on Facebook for about 10 years, and my experience with osteosarcoma began in 1987 when I was diagnosed with OS in my left knee and my left lung. In 2010, I was diagnosed with breast cancer. And 2 years ago, in 2018, I was diagnosed with ALS, which is why I speak funny. And it's such an honor to be here with you. Thank you.
I'm going to talk to you guys today about survivorship care planning as merely an introduction to the Passport for Care. We're not going to talk about how to survive osteosarcoma. If I had that magic ball, I would share it with the world, trust me. But we're going to talk about survivorship care planning and just sort of the quick and dirty of it, because I think that the good part about survivorship care planning and the information that, that we have here is that there's no hard data, there's no funny graphs, there's just obvious, common sense that everybody should have a survivorship care plan. So that's the good part about this. I'm just going to touch on sort of the who, what, where, whys, and whens of survivorship care planning, and a little bit about how people can share things with their providers and the need to share things with their providers and what kind of providers people should be sharing their information with, and kind of how the best and easiest way to do that is. So not a lot of fanciness on these slides. What is a survivorship care plan? You may have heard about them from maybe the Livestrong organization or ASCO. There's a few different versions of survivorship care plans out there kind of floating around in the oncology world. What's key to remember in our world is that we're specific to surviving childhood cancer, even though we know that particularly with osteosarcoma, people tend to have can have diseases that are childhood diseases later in life. And I think think you can wave that flag. But it's still a pediatric cancer, and so the survivorship that we're referring to is specific to surviving childhood cancers. So I just want to make sure that that's clear. And the Passport for Care is specific to surviving childhood cancers. So what's important to have in a survivorship care plan? A treatment summary that sort of includes everything that happened to the patient without replicating the medical record. We're not trying to let everybody know what day you got your carboplatin on. That if we know you got it, it's not like the date mattered. And so we want to have enough information in the treatment summary to explain to anybody that you might be sharing that with what things can happen to you later and why, because that's the why, but not necessarily too much of the nitty-gritty, because we want it to be a sort of a concise, portable product that you can take with you anywhere. Whether you choose to print it out on paper or you take it with you electronically, we want it to not be 1,000,000 pages. We want it to include the potential late effects, what those are, and we recognize that can be a very long list, and we hate to actually put that on the page, but it's the reality. And we feel like if we can mention it, we can manage it. And so we know that our list of potential late effects can be very long, but it's everything that's included in the Children's Oncology Group Guidelines for Care for Survivors. And so we feel like we need to oblige that. Better to put it out there and be able to kind of go through the list with somebody and say, we're not so worried about that, but we are kind of concerned about this. So we think that it's important that what could happen to you is there, and then why. The why meaning what chemotherapy you had, what surgery you had, what radiation you had, and how that's affecting your body. We think it's very important for the tests and exams that you'll need to have done throughout your life be included in the survivorship care plan, whether that's echoes, EKGs, endocrine testing, whatever those things are, because the list is long, the tests and exams can be kind of voluminous. We know that they're there, and we want to make sure that you also know what they are. And that it's accessible to you. And that's why the portability of the Passport for Care is so key. You can pull it up on your phone, you can pull it up on your computer, you could print out anything that you wanted to if you're kind of a paper person. But we're all still paper people, as much as we like to pretend that we are not. So those are key things. And so what I've just shown here on this page is just kind of a little cut from the Passport for Care. I'll show you the actual Passport account when we get done with this, but I just want to kind of give you a hint that you can put treatment centers, surgeries, chemotherapies, radiation, and then in the follow-up care plan, it talks about by body system, what systems can be affected, what can be the problem, and then these things that are highlighted, they're not actually highlighted, it's just a screenshot, are educational pages that come from the Children's Oncology group, but we have access to. All right, so who needs a survivorship care plan? Anyone who was diagnosed with cancer anywhere at any point. Like I said, we're focusing specifically on children, but any adult as well should have a survivorship care plan. Way back, I don't know, 10 or 12 years ago, the College of Surgeons and the Council on Cancer, there were a couple of different groups that were trying, even Medicaid and Medicare were trying to institute that if you didn't write a survivorship care plan for a patient, they wouldn't pay for their care. Unfortunately, because survivorship care is not acute, they didn't really fly, so they kind of had to back off on the payment and reimbursement part. But knowing that that was an issue, I think that prompted a lot of programs to kind of start getting them, starting to get them written. So what we had done way back when was to sort of recognize the need and go forward, and Dr. Poplack's going to talk about that more. But anybody who's diagnosed with cancer and receives cancer therapy, we also include accounts in the Passport for Care for children who have had maybe storage disorders or metabolic disorders that they have had a bone marrow transplant for because they've been exposed to chemotherapy and or radiation and may have been a big dose of radiation in terms of total body. So it is a little bit more expansive than just a cancer diagnosis. It is also inclusive of chemotherapy exposure. When do I get a survivorship care plan? Every center is a little bit different, so that one's a little bit hard to pin an answer on. We, as in the oncology world, I'm sure that when patients are diagnosed, they're concerned about survival from day one. We get that. We also know that as providers, we also are thinking about survival and beyond from day one, which is why we're trying to, figure out how to give less toxic chemotherapy and treatment with less late effects. So each clinic is thinking about that from the beginning. We just don't necessarily give you the Passport for Care account or the sort of the information on survivorship until you are either referred to a survivorship clinic that may be in your center, it may be in maybe a bigger center not very far from you, or it may be to a primary care person that's local that also handles cancer survivors for a center. Sometimes in small centers, that's how they work. But just know that if you are still on treatment, your clinic probably has not approached you with the Passport for Care. So don't panic, they will. It's when you get to survivorship or whatever their version of sending you on to the next step is when you would get a survivorship care plan. But again, every clinic does a little bit differently. It's always important to check with your providers. Why do you need one? Well, because everybody has so many questions, and also there's so many variables. If you were treated when you were young, you don't necessarily remember what you had or why you had certain medicines or treatments. Your parents were incredibly stressed at that time, so they don't necessarily remember everything. And we always give parents this big binder. All of you probably remember the binder, and it still exists to this day. A lot of us still have them. You kind of you have this big pack of information that you carry around, and with the Passport, we're trying to eliminate the need for you to continue to carry the binder into your survivorship world. So we want everybody to have access to a portable, concise product that can go anywhere that they need to. How do you get one? Well, you can get one from your hospital, your clinic, or you can get one from the Passport for Care, which is key information for you if you are a survivor, if you are a parent of a survivor, or if you are a practitioner of any sort of physician, nurse, whatever. You can actually get the same information that's in the Passport from the Passport for Care Survivor portal just by entering treatment features on a patient. And I'll show you that at the end. There are clinics in the world that don't use the Passport for Care. And so even if they aren't using the Passport, they can have access to the same follow-up care information for their patients. What do I do with this survivorship care plan? You share it. You share it with your doctors, with your primary care, with your any subspecialist that you're seeing. We know that that it's not uncommon for our survivors to see endocrine, cardiology, pulmonology, maybe some learning support. The lots of musculoskeletal issues. They're obviously in orthopedics. There are all kinds of people to share that survivorship care plan with. And when you see what the Passport for Care provides on the survivorship care plan, it includes any tests or exams that need to be done on the patient forever and ever, amen. Any things to look out for, how often to do the testing, that sort of thing. So the idea is that you share it. We want everybody to know that this is the great way for your doctors to take better care of you. That's what's really key. And how can it help your PCP or your whatever provider you see, or your clinic? It could be your college health clinic. It could be so many different providers. Is in that it tells them exactly how to take care of you. And if they have questions, they can certainly always go back to your treatment center or your oncologist, or to you, because pretty soon you know that you become the expert. But it can certainly help them know how to take really great care of you and not miss anything, because they may. Usually we hear from survivors that two things happen when they go back to their primary care. They go back and the primary care says, oh, well, you had cancer when you were 10, you're 25 now, I don't need to worry about that. Or, oh my gosh, you had cancer when you were 10, I need to do everything under the sun and panic and make you panic. And there is a happy medium. So that's what the Passport for Care provides, is exactly what needs to be done, exactly when, and then how it needs to proceed for the patient. All right, Passport for Care. I'm going to hand that over to Dr. Poplack because he is going to talk about why he had this great idea and how that all unfolded for the next two slides.
Thanks very much, Ellen. Actually, I was the physician who started the survivorship clinic at the National Cancer Institute. I hate to tell you how long ago. And so this has been a really, in terms of my professional life, a passion for me. And one of the things that is important is the fact that there are very few centers that take care of children with cancer who follow their patients for life. There are about a dozen in this country that do that, but most of them don't. So usually you receive your treatment and hopefully you're fortunate enough to be a survivor, and then you go back to see a family practitioner. And the problem is that most of the physicians that a survivor would likely see in follow-up are physicians who don't have much knowledge about cancer treatment, or about what to do for survivors, what they're at risk for, and how they need to be followed. And so it was for that reason that we developed the Passport for Care. And it has value to not only to the patient, but to parents and to physicians. In many ways, as you'll hear it described, you'll realize that that development of the Passport almost leapfrogged over the concept of having to have a survivorship clinic, because in one web resource, it provides virtually everything that a survivor and the physician who sees them need to follow that survivor for the possibility of late effects. I think you may be aware of the fact that a number of years ago, there was a study done in the New England Journal which demonstrated that up to 3/4 of childhood cancer survivors at some point in their life would have one or more side effects of their disease and or its treatment, and that in about 1/4 of survivors, these can be really serious. So the importance of having something such as a survivor care plan and having it available, and knowing when you have a symptom, whether it's valid in terms of being related to your previous treatment or not, is critically important. And one of the, I think, positive things that came out of the children's oncology group's survivorship group was the development of the survivorship guidelines. And I'm sure that many of you are aware of those guidelines. They're available on the net. If you were to, and really what they did was to have about 25 different committees work together to identify what are the possible side effects of treatment, and when are they likely to occur, and to talk about the severity of them and the details of how survivors need to be followed. The problem is that if you download it and you print it, it comes out as about a 1.5 inch thick document in font size 8. And from a physician's point of view and from a survivor's point of view, if you go into a clinic and it's a busy clinic and you're being seen by that survivor specialist, they don't have very much time to go through and make sure that they've gotten all the possible side effects that you might have as a result of the 8 or 10 or 12 types of chemotherapy or radiation therapy that you've received. So what we did in developing the passport for care was basically to take all of those side effects and realize, first of all, that virtually all of the side effects are linked to a particular type of therapy and to the age at which one received that therapy. So you can basically predict what someone is at risk for based on knowing their history, knowing what type of chemotherapy or the degree of radiation therapy they may have had, and be able to put all that information together. But you can imagine if you're a physician and you're sitting in a clinic and a patient comes in and you don't have an electronic medical record, you're trying to sort through 3 different iterations, 3 different charts, trying to figure out what the treatment was. You can't even get to understand what the possible risks are for even one treatment, and the visit's over. So what we did was to take those survivorship guidelines and basically develop an algorithm. And the algorithm is what is an individual at risk for based on the type of chemotherapy or type of treatment, and at what age did they get it. And since some of the risks or some of that a survivor is likely to be worrying about or to be affected by are things that relate to combinations of treatment. So it's not just one particular treatment, but you may have 4 or 5 or 6 or 7 different types of chemotherapy, and your risk for a particular late effect may be very different, whether you receive the treatment alone or with other treatments. So that's why putting this into a computerized algorithm works. So what we did was to develop this web-based resource, and all that needs to be done is that a survivor needs to spend about, and Ellen can tell you this better than anyone, 25 to 30 minutes with a nurse practitioner, with a physician, or with a caregiver, and review their history and provide the information based on what therapies they received and what age they were at the time. And it really doesn't take all that much time to get all of this information inputted into the passport. Then the value is that literally you are able to, with a click of a mouse, determine what are you as a survivor at risk for, how should you be followed for that particular risk, when should you be followed on a frequent basis or an infrequent basis, what type of tests do you need to be followed for that particular risk or that particular problem, and how often you need to receive that. And so literally, the passport for care gives the survivor all of the information they need to know about what they might be at risk for, how they need to be followed for it, and also it provides educational information about each of the possible risks. So if, for example, you had steroid therapy, then it will describe that there might be a risk for you, or that there certainly is a potential risk that you might have problems with your vision because of cataracts at some later time in life, and how you need to be followed for that particular problem. And it provides wonderful reassurance, both for the parents, because what parents worry about is, after my husband and I, or after my wife and I are gone, what is Mary or Johnny going to do, and how are they going to be followed? That's one of the greatest sources of anxiety for a parent, is knowing whether their child, when they grow up, is going to have the appropriate type of follow-up care and be attended to in the best possible way. So when we developed this initially, you might find this interesting. What we did was we made different scenarios. We wrote down different scenarios of different types of patients who had received different types of therapy and we sent them out to a number of different survivorship experts in the country. And we asked them to sit down, please, and going through the history, identify what they felt that patient history told them the patient was at risk for, and how they should be followed. And then we did the same thing for each one of those patients, but we used the passport. And I would say the analogy is trying to play chess against IBM's Big Blue. You can't beat the computer. And so no matter how good the survivorship clinic was, or the survivorship expert, they always missed something. There was always something that they didn't think about. And but the passport gets it right every single time. And so when Ellen provides a brief sort of review and demo of the passport, you'll see this, but it's of great assistance to the physician, because first of all, it's now in the form that it can be on one's cell phone. And so you can have ready access to this at any time. And you as a survivor can go into a physician who doesn't know anything about your type of cancer, and you can provide them with all the information they need. And literally, what it does is it tells the physician, here are the questions based on this person's history. Here are the questions you need to ask when you're taking a history of them. You need to ask about vision because they've had steroids, or you need to ask about whether they've had any cardiac problems because they've had anthracycline therapies, et cetera, et cetera. So it tells the physician exactly what the survivor might be at risk for, and how they need to eke that out of a history when they're taking the history, and then what to look for on a physical examination, and then how to follow it up in terms of how frequently should this patient or survivor be monitored, let's say for their kidney function, how frequently must they have urinalysis or kidney function tests, et cetera, and why. And so it's really a foolproof method of having, as a survivor, you have a method of follow-up that makes it, that really allows you to feel comfortable, not that it prevents necessarily side effects from occurring. We wish that would be the case, but that it allows one to be followed closely enough so that if there is a potential for a side effect, that you can be followed and be aware of it. And I think that's the most important aspect of it. It's also a great tool, by the way, for teaching. So in the clinic, when we have medical students, for example, to be able to demonstrate how survivorship plans, how important they are, and how they need, and how individual patients need to be followed is really done in a wonderful manner by the passport. So Ellen, do you want to go ahead and do a demo?
Yep, absolutely. As I'm opening up the demo, I just want to sort of remind everybody of the reach of the Passport for Care, and also remind the listeners that it is free to clinics and to survivors. What we haven't really explained here, and I'm not going to go into a lot of detail on, is that there are two sides to the Passport for Care. There's the clinician side, where we enter the patient's information and then generate an access code for the survivor to access their account securely. And then there's the survivor side, which is what I'm going to show you today. So if there are other providers listening to that you don't use the Passport in your clinic, or you might not know if you use the Passport, if you're a general oncology provider, you might not know if the survivorship team is using it. And the help desk email is sort of all over the site. And if you click on that, it will come to me anywhere in the world, and I will make sure that we find out what's going on in your clinic. But I want to let people know that we have about 140 clinics using the Passport for Care, and we have over about 40,500 patients in the Passport. Okay, so the Passport for Care is the web address is cancersurvivor.passportforcare.org. If you Google Passport for Care, you'll get to the website. All right, so what we have on here is the ability to see a treatment summary and a follow-up care plan, in addition to several other features, but I want to show you these first because we've kind of been leading up to this. So the treatment summary is everything that we have entered on the clinician portal side. So for example, this is a pretend patient, and I entered her as if we had seen her in our clinic in Houston, and then she was, seen by our survivorship group, and this is what she sees. This is what the survivor sees on her side once we've generated a code, and she goes in to securely access her account. She can see the treatment summary. It just talks about a little bit of general information with the help desk email, and then it has just some general demographic information. It didn't include everything that we possibly could have. And then the information about the primary diagnosis. And the fields, when we enter them, several of these fields are drop-down lists. So if you're a clinic and you're entering patients, the data entry actually goes very, very quickly. If you are entering on your own on the screening guidelines recommendation generator, and I'll show you that in a minute, it also goes very quickly. It's a drop-down base situation, is very quick, and then you also have the opportunity to enter some subjective fields. So the reason for even including sort of the history is because the survivor may not remember that. And what I heard from survivors is I was getting about 3,000 of them entered and activated in our clinic in Houston, was that they did like to see more information rather than less, even though we keep saying we want it concise, which means I don't want to see like every chemotherapy record you ever had. But they do need to know the chemotherapy that they received, but they do like to sort of hear about what happened to them a little bit in their journey. So we have these subjective fields where we can include those sorts of things. We can put the treatments, same with surgeries. It's a drop-down list, and the way that something ends up on the drop-down list for surgery, chemotherapy, or radiation is that it comes from the Children's Oncology Group guidelines for survivorship care. So we don't just make up the list, it comes from the survivorship committee at COG. And we're pretty wedded to that, even though we know that sometimes people say, oh, well, I'm not so worried about this or that. We kind of stick with the experts. So we don't just kind of make that stuff up. So if the surgery has a potential late effect or can have some issues for the survivor down the road, or maybe the surgery plus something else can have a combination issue, then that made it on the list. So some things, when you look at the list, you think, oh, laparotomy, for whatever abdominal issue, doesn't make that much sense in terms of cancer, but in terms of adhesions later on, yes, it does make sense. So, so that's how things end up on the list. Chemotherapies, I just put in common chemotherapies that are used for osteosarcoma. We, on the clinician side, you can see the doses. We do have a section for cumulative dosing. We don't necessarily put that onto the survivor side, because what if we've missed dosing? Maybe they've gotten dosing at another center that we somehow didn't get communicated with about. We didn't want to give someone false information versus giving them incorrect information. And then there's a section for complications, and these are added on the clinician side, but it's really important for the survivor to know that this is here and to use this piece. Again, it's a drop-down list of complications that are on the COG, available from COG, and then you can subclassify like cardiovascular, and then I chose arrhythmias, and then you can put anything you want in the comments. And I think that what we found with our survivors that really kind of use this, the information is there for everybody that we enter it on, but the survivors that really use it and communicate with their outside providers really have a much better experience, particularly if they're being seen in another center where they can't see our EPIC record. And everybody kind of has their own electronic medical record. So if you're within, let's say, Texas Children's, in the hospital, you can see their pulmonology record and cardiology and everybody else. But if you go outside to a private endocrinologist, let's say, you can't see that record. And so anything that we can put on this page that kiddo can take forward, or when they transition to adult care, or anything that is helpful for them going forward, is key. And so that's why we like to have as much information as possible on here. There's also an opportunity to change it from active to resolved, and then put in any further comments that we feel are necessary, so that they can kind of keep up to date. The adverse drug reactions and allergies was kind of there as a courtesy, because we know that sometimes kids had treatment when they were little and they don't necessarily remember that something happened, or they don't know what kind of reaction they had. We're certainly not trying to replicate any kind of medical record here, but we just know that that's kind of one of those things that somebody might need to find out about. And in the follow-up care plan, a little disclaimer. At the beginning, it just talks about that these are the late effects that come from the Children's Oncology Group. If you have any questions, please talk with your providers. All the COVID information kind of gets in the way of our page, but it's super important right now. And then based on the chemotherapy, surgery, and radiation that we have entered into the clinician portal, it generates the potential late effects, and they're just alphabetically listed by body system. And so this one's starting with hearing because I put in cisplatin. If you hover over the Y, it'll tell you what could cause that problem. And this obviously is the cisplatin. And then the Children's Oncology Group has these really tremendous educational pages that are listed on the COG Survivorship website, and we have a direct link to them here. So, so as they're going through this, if they click on any of these, it will open up that health link. It's a 2 to 5 page document depending on what the topic is. Educational issues, I think, is kind of long. A couple of them are quick and dirty. It just kind of depends on the topic, but they're super informative. And I know the last thing our survivors want to do is walk out of the clinic with a handful of paper to read. Even if they read it on paper, if they read it on the site, wherever, they're super, super informative. They're available in English, Spanish, and some of them are available in French now, and a large number of them are available in Chinese. So, and the key thing to know about the site, about the Passport for Care, is that it is completely translated into Spanish. So if I click the button, we would see it all in Spanish. And we're working on a program right now where we can have survivors who access it translate as needed to their own home language. So we're working on that. But so I would encourage any survivor or family, or even physicians, maybe if you're not familiar with the Children's Oncology Group educational pages, to click on those and see kind of how those display, and use them in your clinic. They're super helpful. They're downloadable, really key for the survivors. So this is a potential late effect list based on common osteosarcoma treatment. So the preamble is that it's long, and we know that it's not as long as it could be. If you had a bone marrow transplant, the list would get longer, and we know that it's scary, but like I said, we feel like if we can mention it, we can manage it, and if we can just talk about what the potentials are, we can talk about how concerned we are about that particular problem happening with a patient, and what we're doing about it, and what kind of symptoms they need to be looking for. And if they took this to their primary care person, that person would also know what kind of things to be looking for. And usually when we do this with patients in the clinic, it's a little bit of a trip down memory lane. They start to remember things about their treatment and kind of, oh, I do remember they told me this could happen. And it elicits a whole different level of history on the patient when we talk to them about each of these things individually. So I really encourage clinics to have their patients be active in the passport. When they come back to the clinic for their survivorship visits, they have a much richer interaction. And we know that obviously organ dysfunction can happen after cancer treatment, but we also know that there can be some psychosocial challenges, and those are on here as well. We know that this can be very scary for survivors and families, and I think that as providers, we get a little reminder every time we go through this with patients when we have this list in our hand, because we can't avoid the hard subjects. And it's really important for everybody to keep talking about these things, because some of these poor kids, they go back to school, everybody's like, oh, well, you're fine now. And there are a lot of cancer survivors, and some of you may agree that sometimes when something happens to you later, you think, well, nothing's as bad as having cancer, so I'm not going to be upset about this. I'm not going to worry about this. I'm not going to make this the focus of my life. But we know that, some PTSD is certainly possible with survivors and parents and families, and we all, I think, should do a better job at sort of addressing that. So it's hard that this is on the page, but it's really, really important. In my opinion, it's just as important as the next hardest section, which is second cancers. So if if it's a potential issue after these chemotherapy, radiation, or surgery exposures, it's going to be on the list. The site also offers a lot of educational information. It's got some research opportunities. There's a whole list of survivorship resources, of which MIB has made the list. That's an important thing to know, that if you're really good, you make the list. And the research spotlight are current studies that are open. We always hear from survivors that say, well, I was always on a study of some sort. What can I do now? And so we put this list on here. So if any of those pertain to a survivor, they can click on it, and it'll take them to being able to access the people who are running those studies. They're certainly not ours, and they're not all specific, like to Texas Children's. We do a survivor spotlight where we like to talk about what's happening in survivorship. This was about kind of everybody getting interrupted with the COVID crisis after we were supposed to have a huge, survivor event, and the old ones are on here. That includes some physicians who were survivors of our clinic, and now are actually physicians taking care of children with cancer, and then a nurse that was treated in our center that defied all of the odds and is a nurse at Texas Children's and is doing great. But probably one of the most important things that I want everybody to see is this screening recommendations generator, because in most situations, you are seen in your survivorship clinic, your information gets entered, you get a code, and then you see your account and you do what you want with it. You share it, you can see it on your phone, whatever you want to do with it. But let's say you don't have a survivorship clinic, or maybe you were treated a long time ago and that ship has sailed. You don't even know where that information could be. Or in the advent of electronic medical records, I think a lot of us would be a little bit shocked to know how recently paper records have been destroyed. And so, like, in the old days, we said, oh, well, if it was not on paper, it's in medical records buried somewhere, or it's on microfiche. It doesn't really exist like that anymore. And so there are a lot of places that don't have information left. And I heard from, I think because of a newsletter that went out, I heard from about 12 women who were of a certain age that might be close to mine, with gray hair, and they had all had lymphoma when they were teenagers. So they're, 50 something now, and they had lymphoma when they were 14 to 18. Their records were long gone. And so just by talking with each of them, I was able to go to the guideline generator, put in enough information to generate what they needed to look out for even to this day. And when they went through the list, they were just shocked at how many things they had already been dealing with. And they all had lists and lists of physicians that they were seeing. And they're like, well, heck, if I had this, I would have stuck with one. So it is super, super helpful. So I'm going to just very quickly enter a couple of things just so you can just see how it works. Oh, whoops. Go one direction, not the other. And there's a little disclaimer at the end. Oh, sorry. All right, so what comes up is literally just a Dropbox. And if you enter, you need to enter some kind of a close date of diagnosis. It doesn't have to be exact. We just want it to be somewhere in the ballpark. And then the treatment features are all drop-down based. So you literally just click the button and choose what you want. And here we'll have a little bit of surgery. Okay, and then hit submit. Then it generates a follow-up care plan that looks a lot like what we just saw. All right, so I'd love to take any questions. Again, we really thank you for having the time to share this with your audience, and Dr. Poplack and everybody, thank you so much for joining us.
This is amazing. This is more than I realized that it was, and I'm thrilled to pieces that it's in partnership with COG, with the Children's Oncology Group, and so everybody can agree that that the follow-up guidelines are the follow-up or what should be followed. And also really delighted that our friends at Hunt a Hope on Wheels are supporting this program. I know it's essential support for this and many other programs, particularly research. But this to be supported on an ongoing basis is so valuable to us. I had one quick question before I turn it over to Amanda, and that is, if I'm going to my doctor, how do I bring my phone and I go, okay, here's need to know, or is there a way I can print this up, or any patient sort of prints up a sheet of paper that they can hand over to their primary care and say, here are some things that we need to look out for?
Yes, absolutely. So if you have been seen in an oncology clinic that uses the passport and they have given you access, you can print off everything on your end. You can print off and choose to share whatever you want to. If you have not, but you know some of the treatment features that you received, the chemotherapy, the surgery, or the radiation, you can go into the guideline generator and do the very same thing. The guideline generator at this point in time is not going to save any of that information, but it will generate a care plan and all the follow-up care that you can print off. Or your doctor could do that as well. You could say, well, I got, cisplatin, VP16, and ifosfamide, whatever, and they can do the very same thing that I just did and spit out the guidelines.
This was amazing, and I think we answered so many questions of our members. But when is someone considered a survivor?
The survivorship guidelines are written to sort of start being applicable 2.5 years after treatment ends. But we know that there are some treatments that have gotten really short. And so even though people still use that kind of as the time point, there may be some clinics that are offering survivorship care to their survivors a little bit sooner. Dr. Poplack, do you want to address that?
I think you said it well, Ellen, that the more survivors who can put in information earlier, the better, because it just makes sense. And then that they're getting the information in at a time when they're likely to be more accurate.
Yeah.
But one thing I would just like to say is, if you ask, why did we develop this type of thing? it would be the following type of scenario. Let's say that you have a child, a boy who may never have seen a Wilms tumor in his or her life, also doesn't know what type of therapy was used 30 plus years ago, and doesn't know the side effects. So the fact of the matter is, this is a situation where the blind are leading the blind. You have close to 500,000 pediatric cancer survivors in this country, and many of them are having symptoms on a daily basis that are referable to a late effect of their therapy, but they go to see physicians who aren't skilled in recognizing them and certainly don't know what to do about them. Well, what the passport does is it empowers the survivor. They have all the information they need. They simply go to see their family practitioner, for example, and provide them with their passport, and that gives them all the information that they need to know as to what to look for and how to follow this survivor who's having a symptom. So yeah, there's a lot of economically, if you're into healthcare economics, there's a tremendous amount of money wasted on people going to see physicians who don't have the knowledge needed to follow survivors. But much more importantly, there are mistakes being made because things are being missed. But with the passport, you won't really miss anything. And we have an agreement, a memorandum of agreement with the Children's Oncology Group, so that their guidelines are actually embedded in the passport for care resource. And for that reason, it's always up to date. And of course, these things need to be updated periodically because we have new therapies, and we learn from time to time that a therapy we thought we knew everything about has a new or a different type of side effect. So there's a certain dynamic nature to this. But perhaps most important is, just pretend you're a physician and you hear about the fact that there's a new side effect for children who had osteosarcoma and received platinum. How do you get that information out to them in society? The bottom line is you don't, because there's no way to reach all of the children who have or had osteosarcoma and are survivors. But with the passport, it allows you to automatically find survivors by disease, by age of treatment. Let's say it's a late effect that affects teenagers or children who were teenagers when they were treated. One can actually identify that and selectively email those survivors and alert them to the fact that there's a new potential problem or side effect that they may want to know about, and give them the option to be able to get that information.
First off, I want to say this is amazing. And I thank you both. Being a 12-year survivor, this is something that I needed because I move around so much. So I thank you both. We have a question real quick. Does this address long-term surgical guidelines for limb salvage surgery patients having procedures, including dentistry and needed antibiotics?
Even though we know that everybody says you need to have antibiotics, it's not necessarily a cancer guideline, so it can be a little bit challenging. So it doesn't always say that. Depends on how it's entered.
We're about to go into OT up here in OsteoBite land.
Well, email me any questions. I'm happy to take them at any point. And if we can help in any way, the help desk email on any of those sites comes to me, I will take care of it.
And Alexis, you might be interested to know that Dr. Poplack's connection to methotrexate, high-dose methotrexate.
He's the man.
This is when we first started talking. I found that I was like, oh my gosh, I have so many questions. So I know Amanda because she is the moderator and founder of a large osteosarcoma Facebook page. gets questions all the time about methotrexate. So, Alexis, can we ask you a methotrexate question?
Sure.
Okay, Amanda, what's the question you always get?
The long-term effects, like if someone has a kidney issue, that's huge. We get that a lot.
A kidney issue related to, can I have high-dose methotrexate?
Yeah.
There are now, there's so much known about how to give methotrexate now and when to give it and when not to give it. And there are actually test doses that allow you to see how that particular patient is likely to handle the drug when they receive it. So it's so much more safe at these days than it was 30 plus years ago when it was first introduced for children with this disorder. I actually took care of one of the first patients to ever receive high-dose methotrexate for osteosarcoma. And at that time, we didn't even know that it was necessary to use leucovorin to rescue patients.
Mhm.
And we were fortunate to be able to save this patient through a lot of very rigorous intensive care. She went on to she's a grandmother now and is doing great. So, but we now know so much more about it, and having renal dysfunction is a potential problem, but one can do appropriate dose adjustments and be able to give therapy in many cases where previously you couldn't.
Yeah. Do you know what? I glossed over my original question and jumped over to the possible question from Amanda. But can you explain your original connection with high-dose methotrexate? What your connection?
I was actually initially resident at Boston Children's with Dr. Jaffe, Norman Jaffe, and Norman came in to me and said, I have a patient who's just been given high-dose methotrexate and she's having all kinds of side effects. You need to save her. And which was, for a young resident, a little bit of a daunting experience, but we were able to do that. And for the next 30 plus years, whenever I saw Dr. Jaffe, he always reminded me of that particular patient and told me how well she was doing.
Well done. Okay, so in the meantime, just between when I said, okay, we have no more questions, and now what has been coming in from both our Facebook Live and from our participants in the webinar is lots of thank yous. I think people didn't really know that this tool that's really an essential tool in a survivor's toolbox existed. And so now, you know, as we say at MIB Agents, know better, do better. We can all do better for our own health and for our children's health if they're the ones who've been likely affected by osteosarcoma. So this is really, really so useful, and really thank you for being here today.
Thank you very much.
Thank you. So on next week's OsteoBites, we'll be honored to have Dr. Pete Anderson from Cleveland Clinic. He's also on the MIB Agents Board of Directors and our scientific advisory team, and he is an osteosarcoma expert, as people with osteosarcoma know. He will be sharing osteosarcoma information and be answering general osteosarcoma questions. So thank you again for joining us today. And of course, thanks to our guests, Ellen Shohet and Dr. David Poplack, Amanda and Alexis. Stay safe, everyone. Wear a mask, hand sanitize, 6 feet, the whole drill. If MIB Agents can be of help to you, please let us know. Together, we make it better for osteosarcoma kids everywhere. On next week's OsteoBites, we are honored to have Dr. Pete Anderson, MD, PhD, who is on MIB Agents' Board of Directors and Scientific Advisory Team and is an osteosarcoma expert. He will share osteosarcoma information and answer your general osteosarcoma questions.